Bismillahirrahmanirrahim. The thought of the day is I am not this hair, I am not this skin, I am the soul that lives within. Assalamu alaikum. My name is Dr. Inshrah and I am a PGR of Community Medicine Public Health at King Edward's Medical University, Lahore. Today, the topic of my presentation is Introduction to Epidemiology, and I'll be giving this presentation under kind supervision of Professor Dr. Saira. Our learning outline will be epidemiology and its history, types and basics of epidemiology, common terms, definitions and formulas, levels of prevention, disease burdens in Pakistan and the world, investigation of an outbreak, recent updates, and then MCQs. Learning objectives. At the end of this presentation, the participants will be able to summarize the history and impact of epidemiology on public health, differentiate descriptive, analytic, and experimental epidemiology, define key terms and apply common epidemiological formulas, identify primary, secondary, and tertiary prevention, and recognize major disease burdens in Pakistan and globe. First of all, epidemiology. The word epidemiology is derived from epidemic, epi among, demos, people, and logy study. It was defined by John M. Last in 1988 as the study of the distribution and determinants of health-related states or events in specified population, and the application of this study for the control of health problems. By examining patterns, causes, and effects, epidemiology plays a crucial role in public health, helping guide decisions on prevention, control, and treatment of diseases within population. This is an epidemiological triad, and you can see for any disease to occur, there needs to be an agent that causes the disease, a host in which disease occurs, and an environment which is suitable for that agent to cause this disease. History of epidemiology. Here is an overview of evolution of epidemiology. Hippocrates' early work. Hippocrates, often called the father of medicine, was one of the earliest figures to suggest that disease might have a natural cause rather than a supernatural origin. He proposed that environmental factors such as water, air, and lifestyle should influence disease patterns, laying the groundwork for epidemiological thinking. John Snow's cholera investigation. John Snow's investigation of the 1854 cholera outbreak in London using data and mapping to trace the source to a contaminated water pump is a landmark in epidemiology. His work demonstrated the importance of spatial analysis in disease prevention. In August 1854, a cholera outbreak struck Soho, London. By mapping cases, John Snow identified a cluster around the Broad Street pump, linking it to contaminated water. After presenting his findings, authorities removed the pump handle, leading to a marked decline in cases and validating Snow's hypothesis. Here is the image of John Snow's figure in John Snow's famous cholera map showing the outbreak in London in 1854, centered around the Broad Street water pump. This is the Broad Street pump, and this is the area where cholera outbreak was seen. Growth of epidemiology in 20th century. The 20th century saw advancements in identifying infectious and chronic diseases, developing vaccines, and understanding risk factors. Epidemiological methods evolved with statistical tools, greatly improving public health interventions and disease prevention strategies. Global diseases, outbreaks, and pandemics. Epidemiology has been critical in managing global outbreaks like the 1918 influenza, HIV/AIDS, SARS, and COVID-19. It tracks disease patterns, informs interventions, and helps develop vaccines, crucial for pandemic control and public health responses. Aims of epidemiology. Identify disease causes and risk factors, determine the extent of disease in a population, study natural history and prognosis of diseases, study interventions, evaluate preventive measures and treatment, inform public health policies, promote health education, and guide research. Usage of epidemiology. Epidemiology is used in disease surveillance, where there is continuous monitoring of disease occurrence and trends. It enables early detection of outbreaks and inform public health responses. Epidemiology is used in policy making because it utilizes epidemiological data to inform health policies. And then it is used in identifying and controlling epidemics, that is essential in managing public health crises. Epidemiological approaches. There are three types of epidemiology: descriptive epidemiology, analytical epidemiology, and experimental epidemiology. Descriptive epidemiology. Descriptive epidemiology involves the analysis of the distribution of health-related states or events in specified populations, focusing on who, where, and when. Its purpose is to avoid a detailed description of health issues and their patterns, to identify and generate hypotheses for further investigation. The key components are who, that involves age, gender, ethnicity, and health status. Where, that involves the local area, regional, or environmental influences. When, that involves patterns over time, including incidence and prevalence. Analytical epidemiology investigates the causes and determinants of health-related events, focusing on how and why disease occurs. Its purpose is to identify relationships between exposure, that is risk factors, and health outcomes. It tests hypotheses generated by descriptive epidemiology. Key components are how, that examines how exposure leads to disease, and why, that investigates factors influencing disease occurrence. Example given lifestyle or environment. Experimental epidemiology. Experimental epidemiology involves the study of health outcomes through controlled experiments, primarily focusing on clinical trials to assess the effectiveness of intervention. Its purpose is to determine causal relationships between exposures and health outcomes. It provides evidence for clinical and public health decision making. Types of clinical trials in experimental epidemiology. There are randomized controlled trials where participants are randomly assigned to intervention or control groups, and non-randomized trials where participants are assigned to groups based on other criteria often used when randomization is not feasible. Key features are blinding. There are two types of blinding: single blinding, where participants are unaware in which group they will be allotted, and then double blind, where both participants and researchers are unaware. Outcome measurement clearly define primary and secondary outcomes to assess the effectiveness of the intervention. Moving forward to the basics of epidemiology. Population at risk. What is population at risk? Population at risk are specific groups with a higher likelihood of experiencing adverse health outcomes due to various risk factors. The characteristics involve demographic factors, health status, or environmental exposure. Contributing factors that may be biological, environmental, or behavioral. And then public health implications. Identifying vulnerable groups is essential for effective public health planning, targeted interventions, tailored strategies to meet the needs of at-risk population. Example given vaccinations, education. Reducing health disparities that aims to improve health outcomes and equity in healthcare access. Common terminologies used in epidemiology. Prevalence, the proportion of a population that has a specific disease at a given point in time. Its formula is total population divided by number of existing cases multiplied by 100. Incidence is the number of new cases of a disease that occur in a specific population over a defined period. Its formula is number of new cases divided by total population at risk multiplied by 1000. Endemic, a disease regularly found among particular people or in a specific area, such as malaria in sub-Saharan Africa, where it remains consistently persistent due to local conditions. Epidemic is a sudden increase in disease cases above and what is normally expected in a specific area, like the dengue outbreak in Lahore, where factors such as climate and urbanization lead to rapid transmission. Pandemic is an epidemic that spreads across multiple countries or continents, significantly affecting global populations, as seen with the COVID-19 pandemic that emerged in late 2019. Sporadic is the occasional disease occurrence occurring at irregular intervals, typically isolated, such as infrequent foodborne illness that do not indicate an outbreak. Zoonosis is the diseases transmitted from animals to humans, often through direct contact like rabies, which can be spread via bite from infected animals. Epizootic is an outbreak affecting many animals in a specific area at the same time, similar to human epidemics, such as sudden increase in avian influenza among birds. And zootic is a disease consistently present in animal populations within a specific area, exhibiting stable prevalence over time, like brucellosis in certain livestock. And then exotic is a disease not commonly found in a region, but may be introduced, posing public health risks such as Zika virus entering non-tropical areas. Nosocomial infections. Nosocomial infections are acquired in healthcare settings such as hospitals, often due to invasive procedures or inadequate infection control, like surgical site infections. Opportunistic infections are the infections that occur more frequently in individuals with weakened immune systems, such as pneumonia in HIV or AIDS patients, due to their compromised health. Iatrogenic infection are the infections resulting from medical interventions, often due to invasive procedures, highlighting the importance of infection control, such as infections after surgery. Morbidity and mortality. Morbidity is the presence of illness or disease within a population. Formula is number of ill individuals divided by total population multiplied by 100. Mortality is the incidence of disease within a population. Incidence of death within a population. Its formula is number of deaths divided by total population multiplied by 1000. Absolute risk is the actual chance of developing a disease over a specified period. Absolute risk is equal to risk in exposed group divided by total population multiplied by 100. If 1 in 100 people develop a disease, absolute risk is 1%. Relative risk is the comparison of the risk of a health event among one group with the risk among another group. Its formula is risk in exposed group divided by risk in unexposed group. If the risk of lung cancer is 20% in smokers and 1% in non-smokers, relative risk is 20 divided by 1 is equal to 20. Smokers are 20 times more likely to develop lung cancer. Odds ratio measures the association between exposure and an outcome, comparing the odds of an event occurring in the exposed group to the odds in the unexposed group. Odds ratio is equal to odds of disease in exposed divided by odds of disease in unexposed. When the odds ratio is equal to 1, there is no association between exposure and outcome. When odds ratio is greater than 1, increased odds of the outcome with exposure. Odds ratio less than 1 means decreased odds of the outcome with exposure. If the odds of developing a disease are 4 in exposed individuals and 1 in unexposed individuals, odds ratio is 4 divided by 1 is equal to 4. Exposure increases odds of disease by 4 times. Levels of prevention. Epidemiology plays a crucial role in identifying and implementing levels of prevention to reduce disease incidence and improve public health. These are the different levels of prevention: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Primordial prevention aims at preventing the emergence of risk factors for disease and health conditions. The strategies involved for primordial prevention of any disease are policy interventions, community development, public awareness campaigns. Primary prevention aims at preventing the onset of disease before it occurs. The strategies include health education and promotion, example given smoking cessation programs, immunization, example given vaccines for measles or influenza, environmental modifications, example given clean water initiatives. Secondary prevention focuses on early detection and intervention to reduce the severity of a disease. The strategies involve screening programs, example given mammography for breast cancer, regular health checkups to monitor high-risk individuals, example given blood pressure checks. Tertiary prevention aims to reduce the impact of an already established disease by improving quality of life and reducing symptoms. The strategies involved are rehabilitation programs, like physical therapy for stroke patients and management of chronic diseases, example given diabetes management programs. Measurement and data interpretation. Bias. Bias is a systematic error in study design or data analysis that leads to inaccurate results or conclusions about the relationship between exposure and disease. It can arise from how participants are selected selection-wise or how data is measured or collected information-wise. If a study on lung cancer includes only hospital patients, it may not reflect the general population. This is selection-wise. Inaccurate recall of past smoking habits in a case control study is the information-wise. Confounding, a situation where the observed association between exposure and outcome is influenced by a third variable related to both. Example is age confounds the relationship between physical activity and heart disease. Older people are less active and more prone to heart disease. Sensitivity, the ability of a test to correctly identify individuals who have the disease. True positives. Formula is sensitivity is equal to true positives divided by true positives plus false negatives. If a TB screening test has a sensitivity of 90%, it detects 90% of people who actually have TB missing only 10%. Specificity is the ability of a test to correctly identify individuals who do not have the disease. True negatives. Formula is true negatives divided by true negatives plus false positives. If a COVID-19 test has a specificity of 95%, it correctly identifies 95% of people who do not have the virus, while 5% may be wrongly classified as positives. Disease burden in Pakistan. Tuberculosis in Pakistan. Pakistan ranks fifth among countries with the highest TB burden, with over 500,000 cases reported annually. Burden of non-communicable diseases. Diabetes. Pakistan has the third highest number of diabetes cases globally, with over 33 million adults affected. Hypertension. About 46% of the adult population is affected by high blood pressure, often undiagnosed and untreated. Other non-communicable diseases, cardiovascular diseases, and cancers are rising, contributing to 58% of total deaths annually. Challenges include limited healthcare infrastructure and high out-of-pocket expenditure, hinder effective management. Epidemiology of COVID-19 in Pakistan. COVID-19 trends and data. First case of COVID-19 was reported in February 2020. Peak time was when the highest case numbers observed in mid-2021 during the Delta variant surge. Total cases over 1.5 million cases with over 30,000 deaths as of 2023. Control measures include smart lockdowns, where targeted lockdowns in high transmission areas, vaccination campaigns, more than 150 million vaccine doses administered, and public health messages, use of media to encourage mask wearing and social distancing. WHO's role in global disease surveillance. The World Health Organization coordinates international efforts to monitor and track diseases, ensuring rapid detection and response to health threats. Key surveillance programs include Global Outbreak Alert and Response Network, a collaboration of 250 institutions that responds to health emergencies worldwide. International health regulations, legally binding framework for countries to detect, assess, report, and respond to public health risks, ensuring global preparedness and coordination. Global pattern of emerging diseases. Infectious diseases that are newly identified or have recently increased in incidence or geographical range. Key examples include COVID-19, Ebola, and Zika virus. Factors driving emergence. First of all, there is globalization. Increased travel and trade allows disease to spread faster across borders. Then there is climate change that alters ecosystems, leading to expansion of disease vectors. Example given, mosquitoes in warmer regions. And then urbanization. Densely populated areas with poor sanitation can facilitate the spread of infectious diseases. Surveillance of emerging diseases. Monitoring is critical for early detection and prevention. WHO's effort in tracking and responding to emerging diseases help reduce the global burden of infectious outbreaks. Investigations of an epidemic. Here is a brief overview of outbreak investigation steps with dengue outbreak example from Pakistan. First of all, one needs to prepare for fieldwork, assemble a team and gather resources. This was done by response team formed during 2021 dengue outbreaks in Lahore. Then confirm the outbreak. Ensure that cases exceed expected level. Dengue cases in Lahore exceeded the usual seasonal baseline. Then define and identify cases, such as set a case definition and identify affected individuals. Cases were defined by dengue symptoms and lab tests. Descriptive epidemiology. Analyze the outbreak in terms of person, place, and time. Cases concentrated in urban Lahore during the rainy season. Develop hypothesis. Identify possible sources of the outbreak. Stagnant water in urban areas increased mosquito breeding. Evaluate hypothesis. Test theories through studies or lab work. Case control studies linked mosquito exposure to infections. Implement control measures. Introduce interventions to prevent spread. Fumigation and public education were carried out. And last, communicate findings. Share results with public and officials. Public advice to eliminate standing water and use repellents. Moving forward to recent updates. Assessment of epidemiological trend of influenza-like illness in Italy from 2010-11 to 2023-24 season. Key points to optimize future vaccination strategies against influenza. The aim of this study was to assess the epidemiology of seasonal influenza in Italy through the analysis of data from the epidemiological and virological respivirnet surveillance system for the season 2010-11 to 2023-24 to identify the epidemiological key points to plan the most appropriate vaccination strategy. The cumulative and maximum weekly incidence of influenza-like illness and epidemic period, beginning and duration in weeks, were assessed in the pre-pandemic period 2010-11 to 1920, and they were compared to the pandemic and post-pandemic one. In all seasons, children reported the highest incidence values of influenza-like illness and longer epidemic periods in contrast with the older population. The epidemic season 2020-21 and 21-22 had abnormal trends, while the last season of 22-23 and 23-24, the epidemiological and virological trends of influenza-like illness were confirmed as reported in the pre-pandemic period but with high intensity. Analysis of trends and forecasting of tuberculosis mortality at the regional level. The aim of the study was to analyze trends and forecasting of tuberculosis mortality at the regional level by use of mathematical methods, linear regression, and model based on artificial intelligence machine learning, and to compare the results of accuracy of prognosis. As of end of 2022, in Sword-Lovis region, the studied indicators decreased by 66.9% compared to the baseline level of 2012. The forecast using regression allowed us to obtain values of indicators close enough to the actual ones. However, it is linear and overly optimistic, assuming zero mortality from infection in the coming years, which cannot be reliable due to sufficient number of tuberculosis patients whose probability of death is not zero. A dynamic simulation model based on machine learning is a more complex and subtle forecasting tool that takes into account many factors, allows you to obtain relevant values of predicted indicators, but it requires increased accuracy, which can be achieved by additional training, which will require search for additional factors affecting tuberculosis mortality. Progress towards poliomyelitis eradication, Pakistan, January 2023 to June 2024. Despite the occurrence of only a single confirmed wild poliovirus case during the first half of 2023, Pakistan experienced widespread circulation of wild poliovirus over the subsequent 12 months, specifically in the historical reservoirs of the city of Karachi, Peshawar, and Quetta. As of June 30, 2024, 8 viral poliovirus cases had been reported in Pakistan in 2024, compared with 6 reported during all of 2023. These cases, along with more than 300 wild poliovirus positive environmental surveillance samples reported during 2023 to 24, indicate that Pakistan is not on track to interrupt wild poliovirus transmission. The country's complex socio-political and security environment continues to pose formidable challenges to poliovirus elimination. To interrupt wild poliovirus transmission, sustain political commitments to polio eradication, including increased accountability at all levels, would be vital for the polio program. Efforts to systematically track and vaccinate children who are continually missed during polio vaccination activities should be enhanced by better addressing operational issues and the underlying reasons for community resistance to vaccination and vaccine hesitancy. The urgent need for dengue vaccination combating an escalating public health crisis in Pakistan. In Pakistan, a country with a population of 240 million, the world's fifth largest, dengue has emerged as an escalating public health crisis with seasonal outbreaks severely straining the healthcare system. Despite decades of vector control efforts, there has not been much success, necessitating the introduction of dengue vaccination to boost population immunity. Recent advancements in vaccine development demonstrate promising efficacy and safety profiles even in dengue-naive individuals. Implementing a dengue vaccine program in Pakistan could significantly reduce disease burden, lower healthcare costs, and prevent future outbreaks. Moving forward to the multiple choice questions. A city's health department is using epidemiology to guide their efforts in controlling an emerging infectious disease. Which of the following actions best represents the role of epidemiology in public health? A. Providing individual treatments to patients. B. Studying health patterns to improve prevention efforts. C. Developing marketing campaigns for health products. D. Conducting psychological assessment. E. Implementing economic policy changes. The correct answer is,
E.
sorry,
E.
no, the correct answer is beta. A public health team examines the stages and complications of chronic kidney diseases to provide insights into its progression over time. Which epidemiological function does this illustrate? A. Measuring disease frequency. B. Identifying social determinants of health. C. Studying natural history and prognosis. D. Evaluating economic impact. E. Analyzing healthcare accessibility.
C.
Yes, the correct answer is Charlie. A public health researcher is studying the link between smoking and lung diseases in a population by examining how smoking as an exposure affects lung health. The researcher seeks to test hypotheses formed in previous studies. Which type of epidemiology is being used? A. Analytical epidemiology. B. Descriptive epidemiology. C. Experimental epidemiology. D. Clinical epidemiology. Or E. Community epidemiology.
C.
The correct answer is alpha. In 2020, a city in Southeast Asia reported a significant rise in dengue fever cases, surpassing the usual expected number for that time of year, linked to recent heavy rainfall. This sudden surge in cases is an example of which epidemiological term? A. Sporadic. B. Endemic. C. Pandemic. D. Epidemic. E. Seasonal.
D.
D.
Yes, the correct
D.
answer is delta.
Sporadic.
Correct answer is delta, epidemic. A physician working in a rural African community sees malaria cases regularly throughout the year, as the disease remains stable in this area due to local climatic conditions that favor mosquito survival. This constant disease presence is best classified as what? A. Pandemic. B. Sporadic. C. Epidemic. D. Outbreak. Or E. Endemic.
E.
E. Endemic.
Yes, the correct answer is ETA. A farmer in a rural area develops fever and muscle pain after handling livestock. Laboratory test reveals brucellosis, which he contracted from direct contact with infected animals on his farm. This type of disease transmitted from animals to human is best classified as A. Epizootic, B. Endemic, C. Zoonosis, D. Exotic, or E. Sporadic.
C. Zoonosis. Zoonosis.
Yes, the correct answer is Charlie. A 45-year-old patient with HIV or AIDS is admitted to the hospital with pneumonia, a condition frequently seen in immunocompromised individuals. Due to the weakened state of his immune system, the infection progressed rapidly. This type of infection is classified as A. Nosocomial infection, B. Opportunistic infection, C. Iatrogenic infection, D. Enzootic infection, or E. Epizootic infection.
D.
Yes, the correct answer is beta. A population study found that 5 out of 1,000 individuals develop type 2 diabetes over a 5-year period. This represents the actual likelihood of developing the condition in that time frame. Which term best describes this measurement of risk? A. Absolute risk. B. Relative risk. C. Odds ratio. D. Incidence rate. E. Attributable risk. The correct answer is alpha. A community health program offers free mammograms to women over 40 to detect breast cancers in its early stages. This strategy aims to reduce the disease's severity by catching it before symptoms appear. Which type of prevention does this example illustrate? A. Preventive counseling. B. Primordial prevention. C. Primary prevention. D. Secondary prevention. Or E. Tertiary prevention.
Primordial.
D.
The correct answer is delta. A health study investigates the link between sedentary behavior and obesity. Researchers note that many participants who are sedentary are also older. and age is associated with both increased sedentary behavior and obesity. What type of variable does age represent in this scenario? A. Control variable. B. Outcome variable. C. Dependent variable. D. Independent variable. Or E. Confounding variable.
E.
E.
Yes, the correct answer is eta. This is the key to all MCQs. This is the link to our YouTube channel. And thank you for your attention.
Thank you very much, Dr. Inshrah. A very nice presentation. And you have covered many important aspects today, starting from the primordial prevention, primary prevention, secondary prevention, demography, epidemiology, the different types of vaccines that are available, especially for dengue fever, epidemics, pandemics, all important different types of disease patterns, asymptomatic cases versus iceberg phenomena. It has been beautifully covered in today's presentation. However, I think that there is a lot of confusion that is going on between primordial prevention and primary prevention. So the primordial prevention is actually before the appearance of the risk factor, while the primary prevention is before the appearance of the disease. There is a lot of difference between the two. The primordial prevention is usually for the chronic diseases. For example, in cardiovascular diseases, we are focusing on the important risk factors so that it cannot occur in future. Similarly, the use of folic acid to prevent spina bifida in pregnant women, again, it is an example of primordial prevention. So the risk factor is not there and we are preventing it, right? While
Yes,
in primary prevention, the risk factors are there and we are preventing the occurrence of the disease. So this is the main difference between the two. And as we are moving towards the secondary prevention, once the disease is there, then we prevent the complications of that disease or the reoccurrence of the disease. So that is called secondary prevention. For example, if someone has the myocardial infarction or angina, we don't want the second attack to occur because the second attack is lethal and it may cause death. Similarly, the dengue vaccine, again, it is the part of secondary prevention. The dengue vaccine can only be given to those who already have dengue fever for once in their lives, and it should be proved on their titers of immunoglobulins. So such a secondary prevention would help them not to get the hemorrhagic fever or death in future. So it is the type of secondary prevention. Overall, it is a very good presentation, and I really like this concept that you have covered many things in one presentation. Very important points have been covered. However, I would like you to please add one or two slides on the recent advances, especially on the mortality that has been prevented by the use of dengue vaccine. Thank you very much. Allah Hafiz.
Allah Hafiz.